Let's take a listen to a young man, Rabbi Alan Green, diagnosed at UCLA Medical Center with spasmodic dysphonia.
Basically, talking is an effort, although you can't hear it so much now. As I talk, it'll become progressively more audible. And I think the problem is myself, that I don't breathe much when I talk these days, and I need to work on that. You can hear the obstruction starting to obstruct now, I think.
Rabbi Alan Green was a presenter at Cedars-Sinai Medical Center. I presented in 1982, cures of spasmodic dysphonia there, and was re-invited in 1992. He was a presenter for me in 1992, and you'll hear his new voice, his cured voice. Let's take a listen to it.
When you find out that the condition really is reversible and you experience that reversibility, it's like being reborn again as a human being, because speech is really that main thing that separates human beings from every other form of life on the planet. We have this ability to communicate in this very subtle and delicate way, and when that gets taken away, it's like being reduced to a lower level of human life, and to be restored to one's full humanity is a gift of God, and it's a very great miracle. You feel very, very happy, happier even than before you lost your voice. To get the concept, really it was a matter of remembering the habit that I had since the time I was a child of speaking in the mask. It was.
But you had been doing that at one time.
Oh, of course. I think everyone begins by speaking correctly in their life. When your responsibilities in life increase and you start to get overwhelmed by certain stresses and tension and pressure, the voice has a tendency to fall into the lower throat, and this is a natural thing. But if it gets stuck there, then you have a problem. You have a communication problem, and it's difficult to get any kinds of words out at all. You start avoiding communication, you start hating the way you sound, you start fearing to speak, and it's a very, very sad situation to be in, but it's such a simple solution. The problem is caused by falling into the lower throat, then one has to just remember the correct pattern, which is to speak in the mask. It's the simplest thing in the world, once you figure it out. As a matter of fact, I went to the UCLA Medical Center to have a very complete workup done on my voice when I had the condition very badly, and they did analysis of the gas content of my breathing, and they did oscilloscope analysis of my voice production, and all kinds of, they also took videotapes of my vocal fold, and all kinds of very sophisticated investigative equipment was used, and they did a beautiful workup, but they sent me out saying, well, there's no hope for you, you have spastic dysphonia. I came back, it must have been about 6 months later, and I was speaking about like this, fairly normally. They were stunned and amazed. They did another workup on my voice, showing that it was completely normal. But they sort of hinted at the end of the thing that if I had recovered from what I had, then what I had was not spastic dysphonia, it must have been something else.
Yet they diagnosed it originally as spastic dysphonia.
Yes, they diagnosed it originally as spastic dysphonia, but they say, well, we can make mistakes too.
When I saw you originally, I said you had spastic dysphonia, no question about it.
Yes, yes. When I walked into UCLA able to speak again, that was a shock to that point of view for the doctors who were involved in the study. But
you saw the same people that you saw before?
Yeah. It was the same exact personnel, same exact equipment, same room in the hospital, everything was the same. But one shock is not enough, and 2 shocks is not enough. It might take 200 shocks, but eventually things do change. It's just ignorance is a very hard thing. It's like a hard rock. The problem that the medical profession has as far as their vision, we went to Cedars-Sinai Medical Center, and we presented ourselves as living proof of recovery from spastic dysphonia. We were talking to the experts in the field at this particular hospital. It was as if we didn't exist. It was as if the words did not record. We spoke, they didn't listen. They were present in the room, they didn't listen. It just didn't make any impression.
These were ear, nose, and throat doctors.
Ear, nose, and throat doctors. And also speech therapists were there too, I think. But it was the proverbial situation of talking to the wall. They might as well not have been there. That was the experience.
My colleagues in the medical center, in ear, nose, and throat, and in neurology, are of the mind that says, and they're united in their position, that spasmodic dysphonia is incurable. They guarantee it in a sense. They tell patients that. That despite the fact I report ongoing cures for 35 years, presenting at medical centers, Walter Reed Army Hospital, the Pacific Voice Conference, Cedars-Sinai Medical Center twice, and on and on and on. I reported cures in the peer-reviewed International Association of Logopedics and Phoniatry in 1980. I've been reporting cures ongoing in the Travis Handbook, the #1 handbook, in my textbook, Modern Techniques of Voice Rehabilitation, and I still cannot tell my colleagues that there is not only hope for spasmodic dysphonia, there are cures ongoing. I have a number of cures of spasmodic dysphonia, and we'll listen to additional cures. Let's take a listen to the Reverend Henry Sellers.
As I go through the day, even right now, I'm tending to raise my voice and go in the upper register.
That's the voice of Henry Sellers, and he sought help. He will tell you what happened to him.
Henry, you were Botoxed because you had spasmodic dysphonia.
That's correct.
And you were Botoxed by one of the best in the business, Dr. Daniel Trong.
Yes.
What happened after you were Botoxed for spasmodic?
I lost my voice for 6 months.
You lost your voice for 6 months?
Yes.
What were you told before you had the Botox? It would take care of it?
I told you it would be 2 or 3 weeks it would be whispery, just wispy, slightly breathy. First Sunday I preached after going to Dr. Cooper, I got a standing ovation because of my voice coming back.
You sought additional help. You went to Dr. Burke at UCLA Medical Center.
Yes, I did.
And what was the exchange?
Well, they took a video picture of my vocal cords and came back in a couple of weeks and said I had spastic dysphonia.
They couldn't tell right away?
He wasn't sure right away. He thought it was borderline.
Okay.
And when I came back and they gave me the diagnosis, they wanted to give me a Botox shot right then.
What did he call your condition?
Spastic dystonia.
You have Parkinsonian now disease. You got it after you had a cure from spasmodic dysphonia.
I was diagnosed afterwards.
Yeah, and you still retain a clear, normal voice.
Yes, I have.
Now, Parkinson's disease impairs the speaking voice in all too many, but your voice remains clear and efficient, despite the fact now that you have a neurological problem called Parkinson's disease.
That's correct. Yes.
You're audible, you're intelligible, you're gracious, you're as friendly as ever. What does that say?
It says that spastic dysphonia is curable.
Now, why is it not okay to report that you're cured? It's a cure. It can't be called anything else. It's not an improvement. You don't have the symptoms anymore. It's not a recovery, just a simple recovery with a potential for regression. It's a cure.
You are cured.
Because they don't know how to treat spastic dysphonia.
You're listening to my colleague, Dr. John Curtis, as well, who is quite taken with the fact that the medical field will not accept or recognize cures of spasmodic dysphonia by what I do, direct voice rehabilitation. Of interest to those who are interested in spasmodic dysphonia, may I point out, I have 15 cures of spasmodic dysphonia alone at UCLA Medical Center, diagnosed by ear, nose, and throat doctors on the staff and faculty there associated with the medical center. The top names in the country, including Hans von Leyden, Henry J. Rubin, ear, nose, and throat both, Gerald Burke, who was kind enough to send me SD patients, Paul Ward, who diagnosed spasmodic dysphonia. We have a very interesting situation. 15 cures and more, as well as recoveries, excellent recoveries by direct voice rehabilitation, including patients from UCLA alone would indicate that there is a pattern to what I'm doing by direct voice rehabilitation which allows me to replicate what I'm doing, and that others who would follow what I'm doing could duplicate what the medical profession insists is a hopeless, incurable problem, and has been so to the medical profession since Traub first described the condition as nervous hoarseness in 1871. I ask of my medical colleagues and the academicians to allow patients with spasmodic dysphonia to have choice of treatment for the condition. I am not opposed to Botox, and I am not opposed to surgery. I am asking if these conditions, spasmodic dysphonia, are not treated properly or well or appropriately, and patients are suffering severely, would it not be possible for them in the medical profession and in my field that says there are no cures as well, that they afford patients the choice of treatment called direct voice rehabilitation. On behalf of my colleague, Dr. John Curtis, and myself, thank you very much for listening to me and hearing cures of spasmodic dysphonia. I'm the only doctor in the world reporting ongoing cures of spasmodic dysphonia for 35 years.